Hi, Desiree.
Hi, Dr. Upadhyaya.
What brought you into the clinic today?
I have some concerns about my weight and how after I had my kids, it's been jumping up a lot quicker than I expected it to, as well as my blood pressure. I have a history of high blood pressure in my family as well as heart disease. So I just wanted any kind of suggestions to help manage that.
Well, that's a really good idea. You've been my patient for a long time, and I have noticed that your blood pressure is rising, and your last hemoglobin A1C would put you at what we call pre diabetic.
Okay.
So, exercise and weight loss are a really good way of preventing both diabetes and high blood pressure.
Okay. Alrighty. Do you have any suggestions for me in that regard?
Well, tell me a little bit about what you are thinking in terms of your physical activity.
Um, you always hear people say go for runs and I go to the gym on a daily, but with two kids, it makes it very difficult to make the time for that kind of thing.
So, you do, what I'm hearing you say is that you go to the gym on a daily basis?
No, not necessarily. I try to, but when I can't, it's only when I can, and it's very, very limited now.
Okay. So, I think to summarize what you've just said is that you plan to increase your physical activity. With two kids, it's very hard to do so.
Mm-hmm.
And that you'd like to maybe come up with some strategies
Yes.
for how you can increase your physical activity and possibly lose weight.
Yes.
All right, very good. So, where do you have a target weight that you're looking for, or a certain amount of physical activity? Can you tell me a little bit about that?
When I researched online, Google MD, I saw that a BMI of my height would be around in the 19s to 20s, and that weight will range around 125. So I was aiming for that, but honestly, just to be healthy is the best bet.
Well, I'm really glad you said that, and I wanted to encourage you by saying that everybody comes in different shapes and sizes. Someone who's overweight might be in better shape than someone who's underweight. So the BMI that you're looking at is around 20 is correct for normal height and weight standards. We also have to remember that everybody's proportion is different. So I'm glad that you said that your health is more important than perhaps reaching a specific BMI that might be identified as normal for your height and gender.
Okay.
Um, so with your goals, uh, did you have a certain amount of physical activity that you might be looking to increase per week?
Right now, at a total, will be like maybe a day out of the week, I would be able to get some good exercise in. I would like to increase that to maybe two or three at least, if not way more than that, because more is better. Uh, but I think time management might be a hindrance.
That's a really good idea. Starting out small is a way of preventing you from getting discouraged. If you make a goal that is unattainable, like that you're going to exercise 3 hours, 7 days a week, it's clearly unattainable for someone just starting out. So, making a goal like you did for increasing your physical activity just 1 day a week for 30 minutes or so is a really good idea. To summarize, I guess what we'd say is your goal is to reach a BMI, which is normal, which is around 19 or 20, and to increase your physical activity by at least 1 day a week and probably more once you reach that goal.
Okay.
Does that sound right?
Yes.
Great. So, what do you think? What do you think might be some barriers, or uh, or what do you think might present obstacles to reaching your weight loss and physical activity goal?
Mainly my kids. I am a stay-at-home mom. My husband works, and I do have other family that could assist in watching them, but they also work, so it's mainly reliant on me. I try to incorporate them into some of my workouts. My toddler loves it and jumps around and does all the stuff with me, but it's still main focus on them rather than my own personal.
That's fantastic. I remember you coming to the clinic before you even had your first child. So now you have two children, and they're both boys, and one is a toddler, age 2, and the other one is just about 6 months old, or 7 months old.
Jumping up there.
That's remarkable. And you're doing all this in addition to focusing on weight loss. I understand that you're also returned to school.
Yes.
That's remarkable. There's a lot on your plate, and it's really good to have a support system like family to help in that regard. So if I could summarize, your strategies are to incorporate your children as much in your physical activities you can, to enlist the help of your relatives, your in-laws, and your immediate family to maybe babysit while you're going to the gym or engaging in regular physical activity. Did you have any other strategies that you might have not expressed yet?
I did recently get a gym membership as a monetary push to try to get more exercise in. Like I said, get when I can, but it's another push on.
That's not a bad idea. Sometimes that accountability that comes with a monetary push. Sometimes they say you've got a little skin in the game. Since you are paying for a gym membership, you're certainly not going to let that go unused, because you would feel like you're wasting money, and that might be a way to motivate yourself better than other ways. It depends on your value system.
Yeah.
So let's talk about how you might be able to make this change.
Okay.
With your children and being a full-time stay-at-home mom, and enlisting the help of relatives, would you think that that you'd be open to, say, incorporating a daily walk into your routine? The reason I ask is because this might be a way to increase your physical activity, and at the same time you won't be needing a babysitter for those times. So talk a little bit about how you might incorporate a daily walk, or how you might be opposed to that.
I wouldn't necessarily be opposed to it. We got a stroller, and I could fit both my kids in it. So go on walks. There's a trail right around my apartment. So get a couple miles in there until one of them, gets annoyed or tired. We'll head right back, but that's still another trek we have to take right back. So whatever I already went, I had to come back and use that exercise. Like I said, the only opposition, I guess, would be their annoyance of being outside too much. But that would pretty much be it.
That's a really good idea. I just wanted to say how much I admire you for all of the things that you're taking on, in addition to taking responsibility and accountability for your own physical activity and your health goals. I think that that's really a way to inspire your children, in addition to other people that might be around you. So I'm hearing you say that you're not opposed to taking a daily walk to increase your physical activity, and that the only obstacle would be that they might be bored or annoyed by that. So to summarize, I think that we can come up with a plan, and you might even come up with a journal where you keep track of your daily activity and your goals, and possibly increase those goals from time to time, and then come and share with your when you bring your children here for their well child visits, or you come in for whatever episodic needs you might have, share those with me and the intake nurse, so that we can encourage you along the way for your own personal weight loss. And physical activity. And when you accomplish that, I'd like you to come back and tell me how you did it, because I don't know myself.
I appreciate that.
And scene.
Cool. Now hit the stop button.